Well, I saw.
Hello, everybody. Greetings from Heart Care Foundation of India, Dr. K. Agarwal Research Fund. I'm Dr. K. Agarwal, President of the foundation, and we welcome on behalf of the round table, which is having its 40th meeting today, which is a good 40th meeting today. So, Happy New Year to everybody. And today we are going to discuss everything about what we have discussed in the last 1 year, what we have learned from the last 1 year. A lot of real role has been played by this round table in coming out the knowledge and the lessons learned. So first, congratulations that we have entered a new era. The second, congratulations that when the new virus came in UK in September, the cases had a second wave. But since September, India's cases have not increased. Indirect that virus has not made an impact in the country. Third, a biosimilar vaccine. A biosimilar vaccine has been approved, is on the verge of being approval in India either today or on Monday. Biosimilar means a vaccine which is similar. Normally, biosimilar agreements occur after the patent is over, but you can also give biosimilar agreements to other nations as a part of the patent exercises. So this Oxford vaccine is a biosimilar produced by another company and not Oxford by itself in India. Because by not by the AstraZeneca in India. India also have a AstraZeneca part. But this agreement was given to but this agreement was given to the Serum Institute of India. Another good news is we have our national president joining here, Dr. Jailal, who just took over as the president of Indian Medical Association. So, in behalf of everybody, I welcome him and congratulate him for taking over the reins of the national president. I wanted to listen to him, his first nation's address, but I could not listen because the SMS came at 5:30 that the lecture is at 4 o'clock. So there was a, that might have happened in the whole country. So request national president, I'm also finding the same mistake that sometimes the delay in getting a SMS is by 2 to 3 hours, specifically at a time when it is a New Year's time with that. Today we are going to discuss basically what we have learned from COVID. Over to Dr. Kalra. And
Thank
kindly have our national president chair the first meeting.
yeah.
He's in the car, but still can chair.
Yeah. Thank you, sir. First of all, Happy New Year to all, especially Dr. Jayalal, the IMA president this year. Congratulations. And welcome to the otherwise 40th meeting and first meeting in the new year of the Roundtable Experts. Today, we will be discussing about the various lessons learned and opportunities, what changes during this COVID pandemic that during last year we have learned. A lot of contributions from these roundtable members are worth praising, and very good Dr. KK Agarwal during this whole year is the pioneer in creating awareness and disseminating the information regarding COVID, the various aspects from transmission to even virology, the genetic structures, mutations, everything, treatment. from time to time, he has been teaching us. And with these words, I will back to Dr. K.K. Agarwal for further continue.
Thank you, Dr. Kalra. So I'll go slow, be in depth, and some of them I will only narrate about what we have learned in last 1 year. But before that, let's have some words from Dr. Jayalal on the chair.
Yeah.
Thank you very much, sir, and wish you all a happy new year. It was a pleasant feeling to be the head, the largest organization of India. But our responsibility is tremendous. We need to do a lot for the welfare of our country. So every member of Indian Medical Association feel it is their bounden duty to do some service to the community, both at the scientific front, public front, and the social awareness also. So I am so happy, and we are blessed with quite a lot of intellectual leaders or the intellectual giants who can give us guidance, who can formulate the ways and means in which how we have to go forward, and direct and guide us in the path of taking decisions, especially on these scientific issues. The COVID has become, when it have all the component, it has a medical or a social component, physical component, and also psychological component. It plays a role. So we need to have a comprehensive look on this, all the aspect of the COVID with related to that. And I'm so happy Dr. K.K. Agarwal with his richness of experience and knowledge and wisdom, and he is able to give us some guidance on the various issues and foretell the warning issues on the COVID, and especially on the vaccine and other things, and he has given a great input. So IMA will definitely adopt his inputs into the resolutions which we are passing in with respect to the vaccine and other issue. So, but apart from this scientific, Indian Medical Association has the social concern of supporting the pathways of the COVID and other of psychosocial impact of the mental, the fear psychosis which is creeping into the society. Also, we are now planning to do a lot of things. And as a roundtable think tank, an intellectual body, and I wish not only our focus will focus only on the physical and the medical component, and we should extend our vision and horizon, which is going into the level of other part of this psychosocial, the spiritual, the mental, and even the financial outcome and economic valuation on this COVID era. Because people like somebody who is good at science will be always able to give guidance in all the fields. So, as a head of the organization, my appeal, Dr. KK sir should give input on all these components of a comprehensive coverage for the COVID. I'm sure that Indian Medical Association will be happy to listen to his inputs and follow them in the days to come. Thank you very much for this opportunity.
Thank you, Dr. Jayalal. Let me share my slides. So I'll come back to into various segments. So my first segment is in prevention. So this taught us a marker that before, during, and after COVID, bring your CRP to less than 1, which I will be talking again and again. That if you want to prevent, treat, or follow up, bring your inflammatory marker to less than 1. It told us for the first time the definition of cumulative time exposure. At least I was not aware there is something like a cumulative type exposure, and that's the reason probably our so many doctors died, because we used to think it is 15 to 30 minutes of a one-time continuous exposure. But now they say if you meet 15 people positive, 1 minute each, it accounts to a cumulative time exposure. This was a new learning for me. It also taught us these 3 words everybody knew, but we forgot after the MBBS, the difference between isolation, quarantine, and monitoring. For the first time, it has given us a direction that we can cure and eradicate MDR TB from our area. We can eradicate streptococcal sore throat, because the word isolation now is well versed with the people. We just have to say, if you have a streptococcal sore throat, isolate yourself for 1 day. And if you are TB positive, isolate yourself for 7 days till you become sputum negative. So that's a new lesson learned, which will help us in eradicating herpes zoster, measles, chickenpox. So their word answer has to be isolation. People will say, how many days? It has also told us two important things of that anything which is bitter and astringent, anything which is bitter and astringent in food is anti-inflammatory. Is anti-inflammatory. This message comes from gastroenterologists. Like we use the word in a condom, correct and consistent use of condom for HIV protection. The facial mask gave us the importance of correct, consistent, and continuous use, not use of facial mask. Facial masks were never in our any list of prevention. Even in tuberculosis, we never had a compulsory facial mask in a respiratory OPD. When people used to come for an OPD, we never used to talk about facial mask there. For the first time, we have now come back to from cough etiquettes to washroom etiquettes. That is, the washroom can be a source of aerosol. For the first time, we came back to SpO2 monitoring. We gave so much importance to SpO2 monitoring and 6-minute walk test that now 6-minute walk test will be used extensively in asthmatic, COPD, heart failure, respiratory failure, interstitial lung disease patients. And SpO2 monitoring will tell us home management will become very, very, very simple. For the first time, we learned about the closed versus open environment. All of us have seen shift from open to closed environment in hospitals, single rooms. The Nightingale original ward were open environment, बड़ी बड़ी छतें, बड़े बड़े कमरे, ऊंची दीवारें, fully ventilated rooms, and we shifted to small rooms, closely ill ventilated and ill lighted rooms. Now we are going back from closed to open environment. New hospitals will be different. If you can share an economy ward journey and you have a sharing of huge number of everybody sharing the same bathroom, you can do the same thing in a hospital also. We have shifted for the first time from dental to oral and nasal hygiene. There was not so much importance given to povidone iodine gargles, nasal wash, except by the ENT. Every time we used to talk about the dental and gingival, less importance was to the oral cavity, nasal hygiene, and the eye hygiene. For the first time, we have come back to the Atithi Devo Bhava concept, that when an outsider comes to your host, पहले पैर धुलाओ, हाथ धुलाओ, मुंह धुलवाओ पोविडोन आयोडीन से, फिर उसका लॉस ऑफ स्मेल, लॉस ऑफ टेस्ट चेक करो, उसको मीठा खिलाओ, उसके ऊपर में इत्र छेड़ो, तब उसको नमस्ते करो और दूर बिठाओ. We have for the first time understood the importance of namaste to over handshake. That namaste basically takes away face-to-face interactions. जब आप नमस्ते करते हो तो your viruses go downwards. And for the first time, we have learned the importance of high viral load and mutations. So we have also understood that high viral load is important in the body. And we have also understood there are medicines Whether they are successful or not is a separate issue. The terminology, can we have drugs not to allow replication of the virus? Whether it is hydroxychloroquine, ivermectin, zinc, these are the medicines which came, famotidine, none of them has been put an impact to be used universally. But it told us a lot about the possibilities of preventing a virus. And it told us the importance of viral shedding versus replicative virus. We have never given importance in the past to viral shedding because isolation was never considered a part of the treatment in the past. So in the symptoms we have learned, there are two types of fever. The first fever is called interferon IL-6 fever, which resets the biological clock. And then we have understood another type of a fever, which is called as a cytokine fever. The first one, biological clock, actually is not called fever. It is called low-grade fever, less than 100.4. And now we have understood another term called cytokine fever. They need to be differentiated because one indicates proneness to cytokine crisis. Other one is benign. So these are two types of fever, benign and malignant. And today we know the cutoff is 101. So cutoff is 101. We have understood that a viral disease also can have subclinical presentations. You can have subclinical thyroiditis, subclinical myocarditis, subclinical appendicitis, subclinical cholecystitis in the same patient. Now it has told us that whenever there are inflammation, there are 5 locations where the inflammation can come. Eye, so you can have the showroom is the eye. Then the skin, eye and skin are the showrooms. You can pick up the disease early. GI manifestations, heart manifestation, and a blood liver manifestations. And apart from that, and you can have thrombus symptoms because of thrombosis anywhere. So it tells us there are 2 types of symptoms, primary symptoms and symptoms due to thrombosis. Thrombotic symptoms will be wherever thrombosis occurs. But it has told us the 5 primary locations for inflammation in the body. Apart from locations means the systemic locations. Lung is the primary location. The systemic locations are eye, skin, GI, heart, blood, and liver. Primary location is, then you have a local inflammation is, local is the lungs. Then it has for the first time give us the importance of loss of smell and loss of taste is equivalent to RT-PCR. It has given us an indirect test that if loss of smell and loss of taste is there, it is pakka COVID. Then it has also told us that loose motions is potentially, if there is a family getting infection, if somebody is having loose motion, look for him as the primary case. That is the index case. Then it has also told us that predominantly we have left eye involvement. So if you have a left eye conjunctivitis in this era, it is COVID-19 unless proved otherwise. It has also told us 2 responses, Tachy and Brady. For the first time, it has told us that all fevers with relative bradycardia need not be typhoid. It can be because this relative bradycardia with a false positive typhoid test, most of the patients who died, they were earlier treated with typhoid, and when they deteriorated, they died. So this caused a new learning that fever with bradycardia is COVID in this era, and the typhoid test can be false positive. It also gives us an important negative connotation. It says, apart from mesenteric lymph nodes, any lymph node involvement, primary hydrocephalus, ascites, pleural effusion, joint effusion, pericardial effusion, or hoarseness of voice rules out COVID. So it told us if you have a mediastinal lymph nodes, it's not COVID. If you have pleural effusion, it's not COVID. If it's a pericardial effusion, it's non-COVID. Now, again, remember, it is not primary COVID, but once you get thrombosis anywhere, then you can get these symptoms. In diagnosis, it told us many points. It told us the importance of CRP. That CRP is a surrogate marker of IL-6 and fibrinogen and D-dimer. That CRP starts rising within 4 hours. That CRP doubles every 8 hours. That CRP reaches its peak in 36 hours. That CRP crashes within 17 hours. So it told us the importance of a rising CRP is more important than a stationary CRP. It told us the importance of baseline D-dimer, CBC, and CRP. So if the baseline D-dimer is more than 1, if the baseline TLC is absolute lymphocytic count is less than 1,000, and if the baseline CRP is more than 10, these are the patients where prognosis may not be good. It has told us do not rely on ESR because ESR may take much more longer time to recover. It may even recover after your clinical recovery. It also told us in India, ferritin is not reliable. Because of anemia, all of them have baseline low ferritin levels. So even a normal ferritin level may mean that the patient is sick. So we have seen a lot of patients who have been neglected on the ground that your ferritin is normal. That means you don't have acute inflammation. That was because of a low baseline ferritin levels. Now it has told us another thing, that D-dimer, rising D-dimer, reducing platelet count, and reducing LDL is a marker of severe thrombosis. Severe thrombosis marker, because LDL is consumed, platelets are consumed, and D-dimer is produced. It has for the first time told us a change in our policy. Our policy was only to get fasting sugar done. Of late, we were only concentrating on fasting sugar. And now for the first time, it has said no. It is the PP sugar which will rise in COVID. The fasting sugar may be normal. It told us about a new concept of markers of inflammation. Up till now, markers of inflammation meant rheumatology. Now we are talking about markers of inflammation. Now, if you are going for a surgery, now we start asking, do you have any marker of underlying subclinical inflammation or not? And if you find one, you will find these cases will have a lot of non-healing wound. And if you find any patients with marker of thrombosis before surgery, these are the patients who will develop more thrombotic episodes. It told us markers of pneumonia, that on day 3 or any day or after day 3, so on or after day 3, if you have fever more than 101, CRP more than 10, or ground glass opacity on CT, it is pneumonia. It told us TIFA test can be false positive. Up till now, the CT value was always considered as a query role. For the first time now, ICMR and also come back and said, if your CT value is less than 30, we will check for your UK strain. So for the first time, ICMR has given the importance of the CT value, which we have been talking about it for quite some time. And ICMR has been saying, why do it? Why disclose it? Now, ICMR new guideline says if your CT value is less than 30, and if you have returned from UK, we will check your genomic analysis. It has also told us for the first time, up till now, we never used to classify pneumonia into segments. It has told us 5 by 25, 7 by 25, that's a new learning. It has told us a new word called GGO. Up till now, we never gave importance to ground glass opacities in a CT scan. Even if we used to say viral pneumonia, but the word GGO was a new learning. For the first time, it has told us that acute fibrosis, interstitial fibrosis, can be reversible. Up till now, we always learned fibrosis means irreversible. Now we see is acute corona-induced fibrosis is reversible in first month in 70% of cases. For the first time, it tells us in a routine way, normally when the TSH is lowered, T3 should be high. Or if T3 is low, TSH should become high. But in this condition, we are getting both of them together. In this condition, it has told us that apart from dengue, now you have another condition with fever. If SGOT is more than SGPT, look for corona. And it has also told us the importance of virus loads. Sooner or later, labs will be checking for the virus loads as we check it in hepatitis B and hepatitis C. Now, what are the lessons learned in treatment? In treatment, the lessons learned are that bring your CRP to less than 1 during and after COVID-19 and keep it less than 1. It has also told us that WHO and USA may not be the fastest and quickest. You have to take your own decisions. WHO this time faulted everywhere. There was a delayed response everywhere. It takes time because they have to consider all the countries together. And USA policies may not be the best. We can see the results there. You have to build up your own policies. It also told us a concept that vaccine is possible in 1 year. And remember, the vaccine which is coming in India is a biosimilar vaccine, like a biosimilar monoclonal antibodies. This is a biosimilar vaccines. Biosimilar vaccine means that you have taken the formula and you are producing of your own. The exact formula of it may be a similar. Biosimilar means you have to go like we have biosimilar antibodies, which is coming in India. It has also told us that rising CRP on day 4 is a sign of continuing inflammation. It has also told us 2 pathways of treatment, the interferon 1L6 pathway versus IL-1 beta pathway, which is a pathway of pyroptosis. And this pathway, both the pathways required different treatments. It has also told us to treat the patient and not the report. It has told us start early, hit hard, the thromboinflammation. It has told us by any way you bring your CRP back to normal by day 4. It has told us that if lymphocyte counts is not rising by day 7, it's a sign of persisting inflammation. Now, this is most important thing is start antivirals before day 3. And now we know if antivirals are started late in the illness, they may be responsible for mutations because NSP14, which is a non-structural protein, 14 component of the RDRP is inhibited by, which is a proofreading mechanism, is inhibited by remdesivir and favipiravir. It has told us that in future, most of the diseases will be treated in home with a teleconsultation. It has given us the importance of day 1, 3, 5, 7, 9, 11. Every day gives you a signal that your disease is going out of control. It has given us introduction to diseases like black fungus, tocilizumab, baricitinib, thymosin, etc. in viral illnesses, it has told us that viral illnesses may require complete rheumatology knowledge. It also tells us again that hemoglobin will fall by 2 gram, and that's the important. That in India, number one cause of headache in the post-COVID may be a fall of hemoglobin by 2 grams due to iron deficiency. It has told us the importance of prone positioning, which we never gave importance in our life. It told us from ventilation to NIV to HFNC. Then it told us over-treatment can lead to mutations, which is the latest in the last 1 week. We are talking about that mutations are linked to either antiviral drugs or plasma therapy. It told us how to do a risk triage in the same family. In the same family, if you have 15 people sick, how to do a risk triage and save every one of them. It taught us about early steroid in a viral illness. Normally, we used to say steroids and virus illnesses don't go together except for seventh nerve palsy, And it gave us a concept of pyroptosis drugs. Now, when you have a cell death, there are 3 types of cell death. One is called as necrosis, which is because of trauma. Second is in response to a stimulus. It can be apoptosis, which is natural cell death, non-inflammatory. Then you have pyroptosis, which is inflammatory cell death. And third is necroptosis, which is also non-inflammatory, inflammatory cell death. All 3 of them together are called panaptosis. And now panaptosis has been told to be the main reason for cytokine crisis. Therefore, pyroptosis pathways today, which is predominantly NLRP pathway with nuclear factor kappa beta pathway, now has become important than IL-6. It has told us about types of immunity. Immunity is not nutrition. Immunity is nutrition plus vitamins plus minerals plus anti-inflammatory diet plus anti-thrombotic diet. It has told us 3 definitions: COVID, first 7 days, post-COVID, 7 days to 28 days is post-COVID. Then it has told us a long COVID, which is up to 3 months. It has also told us there are 2 types of immunities, 2 types of antibodies which are formed, neutralizing and adaptive. And it has said that if neutralizing antibodies are not formed, binding antibodies are formed, you may have an adaptive immunity failure leading to multi-system inflammatory disease or recurrent of inflammation in the same patient. This is for the first time we understood the meaning of adaptive immunity failure. It told us an anecdotal finding that in a menstruating woman, the symptoms may reduce. For the first time, it told us, go back to nature, be conservative, postpone emergent surgeries. That means do emergency surgeries only if it is a must. It told us that in acute emergencies, go back to conservative approaches. We have shifted back from stenting to streptokinase or TPA or tenecteplase in heart attack. It has told us that non-S antibodies with high CRP, that means if your body shows that you have absence of antibodies, then you presume these are binding antibodies with high CRP. That's a serious matter to follow. And it has also told us that cellular immunity testing, US has declared that they are coming. Now, what are the lessons learned in a vaccine? That it is possible to have a rapid clearance. It is possible to have a vaccine in 1 year. That is only possible if your data is analyzed by the regulator simultaneously. Normally, the regulator says, complete your project and submit. But after, suppose you are doing 3,000 cases, after every 500 cases, you submit the data and a meeting takes place, then it is possible to reduce that to a substantial, you can reduce the numbers. For the first time, we re-emphasize on the word types of vaccines. We never used to worry about We say flu vaccine. We never used to say which flu vaccine. We never talked about which pneumo vaccine. Is it live vaccine? Is it killed vaccine? So up till now, our importance was vaccine. So who was teaching us? The pharmaceutical companies. We never went into why should we take this vaccine? What will be the reactions? What will be? For the first time, we understood the meaning of emergency use authorization all over the world. For the first time, we understood the causes of hesitancy, why people are hesitant in taking. And for the first time, we understood the meaning of consortium, that companies can make a consortium and they can be given the vaccine through the consortium. For the first time, we understood that after phase 2 also, it is possible to have a drug, a vaccine, or an antibody being launched in the country. For the first time, we understood the meaning of broader good, that is a disaster act. That what is a disaster act, what is the epidemic act, that for a broader good, the country can take action. For the first time, we understood the meaning. Up till now, we used to say serious adverse events, but we never understood the word diseases of special interest. This is a new terminology which has come in adult population. Diseases of special interest means after vaccination, whatever you develop, you need to divide. You need to decide whether this is a disease of special interest. Say, for example, today I get a vaccination. In the evening, I fight with my wife. So I will blame it to the vaccine. So all those cases where you need to differentiate, it is not vaccine induced. For the first time, we came to know that children can be a last priority for a vaccination, like in Corona, because they are less contagious. Up till now, vaccination means children. But now we are talking about only adults, children later. For the first time, we know the importance of -70 to 2-degree temperature, different types of things. This is the last slide. What have we learned in terms of knowledge? So we have learned CRP should be less than 1 before, during, and after the COVID. For the first time, we have understood the word biosimilar, because COVID-19 Covishield vaccine is a biosimilar vaccine. It is not 100% same as the Oxford vaccine in UK. We have understood one inflammation, one marker, one prevention, and that is CRP. That means if your CRP is less than 1, you are handling all fight between self and non-self, whether it is pollen, whether it is bacteria, virus, protozoa, whatever enters in your body, they are going to increase CRP. And if your CRP is less than 1, you are hitting at obesity, hypertension, diabetic, metabolic syndrome, fatty liver, heart attack, virus disorders, all in one goal. It has told us to go back to the basics, and that is cell physiology, anatomy, and biochemistry. We should not forget about physiology. So I'm doing a big campaign with, I'm in process with having physiologists, microbiologists, anatomists, pathologists, to basic sciences to work together and come back with protocols and forget with modules for us to understand at a physiology level. For the first time, it told us to revisit our anatomy in thymus, virus structure, virus behaviors. It has taught us that how a vaccine is formed. It has told us about repurposed drugs importance, and that is only possible if you are clear in your basic sciences. And if you are clear in basic sciences, you know that why this repurposed drug should act. It has told us there is a lifestyle, and the name of the lifestyle is, we used to say, it is a lifestyle disease. Now we need to decide, is it a pro-inflammatory lifestyle disease or a pro-thrombotic lifestyle disease or a non-inflammatory lifestyle? Now it has told us, comes from Dr. Shiv Sareen, that we are in process of launching a campaign called Barber Taylor campaign. बार ना ही है, वो आपके पीछे बता सकता है कि आपको इंसुलिन रेजिस्टेंस है कि नहीं है, क्योंकि पीछे काला रंग आ जाएगा। और दर्जी आपको बता सकता है कि आपको मेटाबॉलिक सिंड्रोम है कि नहीं है, क्योंकि वो जब देखेगा आपकी पेट की चौड़ाई ज्यादा है। So they are the one who should be able to be involved. So I want to start a training programs for barbers and tailors, how to recognize that your CRP is more than 1. It told us a formula of K, that is Kadwa and Kasela. It told us the importance of three words, CRP, CPR, and PCR. They all contains the three words. They all are important. कि अगर आपने PCR कराओगे और साथ में CRP कराओ, नहीं तो CPR करना पड़ेगा. It told us the importance of moderation and variety. It told us the importance of balle balle means loss of smell, loss of taste means you are not going to die. It told us difference between white and red blood thinners, importance of white and blood thinners. It told us the types of cell death. It told us the importance of self versus non-self. And it told us the importance of pro-inflammatory versus pro-thrombotic states. It taught us about virus spreading behaviors. कि जोर से बोलोगे तो वायरस ज्यादा दूर जाएगा, धीरे बोलोगे तो वायरस कम जाएगा. It gave us the importance of negative pressure rooms, and it told us about neutralizing versus binding antibodies. There are a lot more, but this is what I thought are the important lessons learned by people like me in the last 1 year after talking and discussing with all of you. We welcome Madam Balveer Verma. She is coming after a long time to this forum, please. And Shashank Joshi also to be here. Shashank can also add to, because many of these lessons have come when we interact, where myself and Shashank have been interacting on many platforms. Yes, so kindly, Dr. Kalra, let this meeting be chaired by Dr. Shashank Joshi today. Somebody has to chair, so let it be chaired by Shashank and open for discussions.
I think Happy New Year to all, and I think I congratulate Professor K.K. Agarwal. You have been simply outstanding with your method of investigative medicine. You have been a detective, an investigator, a clinician par excellence. So I think we must all from this group put our hands together for congratulating you for your wonderful work for 2021. And I think all of us here would unanimously support that. I think you have been continuous in that, and I think let us put our hands together for your outstanding work, sir. Because I think you have been simply amazing. You continue inspiring and instilling confidence in people at large, and I think that is so important. You reached out to doctors, you reached out to healthcare professionals, you reached out to masses, and that was so crucial. And then you crystallize evidence, pearls of wisdom, anecdotes, clinical pearls, and try to put all of them under one roof. So I think that is something there. I'm sure a lot of people will have their commentaries, questions. So I think I'll open this up now for comments. Balbir Verma, madam, you can start. And then I'm certain that there is a lot of people who are there. Dr. Jayakishan is there. Dr. Kalra is there. And, a lot of other people on the, we can just have a small discussion, commentaries, additions. Dr. Rai, Dr. Mishra. So many people I have come to know because of you, Professor Agarwal. And then maybe I'll just sum up 1 or 2 points. But I think you have pretty much summarized everything. How this predictably unpredictable new virus, needed so much of learning and unlearning. And in this kind of information overload, where people often relied on fake news, Google, WhatsApp, you have synthesized the right information, picked up clinical pearls from treating clinicians, and tried to make a perfect admixture. We also tried to crystallize ancient wisdom, which is there in our Hindu philosophy or general philosophy in general from India, and tried to mix it with the current contemporary practice. You also have looked at art of medicine and the science of medicine. So I think that is all you have tried to crystallize. So, Madam Verma, you can start, and then we can just go across a round table quickly. But I once again congratulate you, sir, for your constant support and pushing all of us hard to generate good science.
आवाज नहीं आ रही मैडम.
मैडम अनम्यूट कीजिए.
Now can you hear me?
चलेगा क्या?
अभी सुनाई दे रहा है?
Yes, madam.
I would just like to say Happy New Year to all of you. And I second very heartily Dr. Joshi's comments about Dr. K.K. Agarwal, because it's a really big contribution that you have made to general awareness among the public all over the country. I've had discussions with people who are not in Delhi, friends, colleagues. When I'm talking about something to do with COVID, they say, but Dr. K.K. Agarwal said this, but Dr. K.K. Agarwal said that. That means people all over the country are really listening to you, and they trust you, whatever you are saying. I will not take much time because there are much more expert people than me to contribute. I would just like to highlight one thing. One lesson that we have learned from all this is also the importance of public health infrastructure in the country. And right now, because the budget allocation, the budget is coming on 1st of February. The finance minister holds talks. Hello. The finance minister holds talks with the stakeholders about budget allocations in the weeks prior to the actual budget. So I would like to, I hope that people from this group and other professional lobbies are having talks with the government to emphasize the need for increasing budget allocation for health infrastructure in the country, which has been, as you know, in the last 5-6 years, the budget has actually been getting reduced. The net budget for the health infrastructure has been getting reduced. And if one thing COVID has taught us, this is, I'm speaking from a general point of view, is the importance of the public hospitals, the district hospitals, and general, all public health infrastructure. So I hope Dr. KK and others are in touch with people in the government and lobbying, even officially holding meetings, so that the budget allocation is, there is a large increase this year. So thank you very much.
Thank you, Madam Balbir. You make a very, very important point. Only 0.8% of our GDP is being spent on health, and at least it should be 4%. I think it is very important that you have sensitized this group, that we should petition with the government at least to increase that 0.8% of GDP to go at least up to 4%. And there's a huge need to build up the public health infrastructure, right from tele-based health to probably critical care units across the length and breadth of the country. So I think you make a very valid point, and I'm sure Agarwal sir will take up that point further. Quick comments from Karla sir and Dr. Ashok Gupta, then we'll go to Dr. Jaykrishnan.
Thank you, Dr. Shashank. I think the COVID epidemic, as already enumerated by Dr. Agarwal, has given a lot of learnings, especially the public empowerment, public awareness definitely has a big role to play. Now, for all other problems we are struggling, whether it's the infections or otherwise non-infectious diseases, public awareness and their role, their empowerment is a crucial. That will help for our healthy communities. What Dr. Agarwal has done during this COVID epidemic, he has touched upon every information regarding to COVID to masses. And this roundtable group is also had a lot of contributions in decision making, policy making. I think we should continue with the rather much more now. Once we have seen the result, probably now this roundtable group has a bigger role to play in future. Time is short. I will request others to continue. Yeah.
Thank you, Dr. Joshi. I just want to share my compliments to Dr. Agarwal for making it so comprehensive, so concise, and I would go beyond the round table. The quality of Dr. Agarwal to make it so simple, like a surgeon like me can understand, which I mentioned last time. He should really take this practice of making it so simple to all our postgraduate teachers and undergraduate teachers in the university level, because the subject otherwise, what you can learn from Dr. Agarwal's lectures was so difficult to even learn from the articles and textbook. So Dr. Agarwal should lend his ability to make it simple to all the university level and the health university level. That will be a great help for the undergraduate and postgraduate teaching. My compliments to Dr. Agarwal once again. Thank you.
Thank you, Dr. Gupta, Dr. Kalra. Dr. Jayakrishan.
Sir, may I come in for a minute?
Yeah, please.
Sir, I have a question from Dr. K.K. Agarwal.
Yes.
Sir, if I have a choice, I have all the vaccines with me, so which one I should take?
So I'll give you a couple of clarity in this. Now, when we go back to vaccine of, so decision has to be the job of a doctor is to explain and then take a shared decision. So let's say the messenger RNA vaccines, they will take time 1.5 months to produce immunity, because we have seen one case in UK, in America, who developed the virus within 1 week after the vaccination. So mRNA vaccines will take 1.5 months to produce the immunity. They will be available in India soon. India has already cleared the policy of import and export of vaccines. Number 3, there is a rumor going on that this vaccine can change the DNA. The answer is no, because this is not entering the nucleus part of the body. Number 4, because of RNA vaccine, they are inflammatory in origin. And remember, in mRNA, CDC has clearly written downward, also check for MIS, multi-system inflammatory disease. So they have not ruled out inflammatory adaptive immunity failure, that if this virus produces more of a binding antibodies, you may develop some secondary inflammation. They have not ruled out, to watch for, but it is giving you more than 90%. There are 90% chances that you will get the immunity. Now, coming back to the vaccine which is cleared in India as on today, which is a protein-based vaccine with a virus from a chimpanzee. This is a biosimilar. That means you'll have to rely on the Indian trials also, because the preservatives ingredients may be different from that. It's like Indian Coke versus American Coke. Coke is the same. One peculiar thing you have seen in this Covishield is they have given time for second injection from 4 weeks to 12 weeks, which has not happened in any other vaccine. In any other vaccine, we say it was only in, even in hepatitis, the second vaccine is after a month. So Covishield, they have said you can take the second vaccine after 4 weeks, between 1 month and 3 months. So they've given a very big window. That means there may be that the first response of Covishield is giving good amount of immunity. That's my assumption. The very fact they are saying, and the government is envisaging that if we give Covishield, we will be able to cover more population with first dose, and the first dose may help in producing herd immunity. For a broader good, Covishield will be the drug of answer, because it will produce a slightly, even if you miss the second dose, you will be protected from the vaccine answer. But we don't know about the neurological complications like transverse myelitis, but that can happen with any such vaccine. We have never bothered about that. So as on today, Covishield is safe. Even 1 dose may give you significant immunity from getting a serious illness. The third which comes is a killed vaccine, which is Bharat Biotech. That will be the safest vaccine, but still not available. So we will restrict ourselves to 2 vaccines as on today, RNA versus this vaccine. The third vaccine will be Sputnik. That will be, the answer will be the same as that in Oxford vaccine. All other vaccines as on today are not available. So the answer to Madam Upasana is you have only 2 options in India, sitting in India, either Pfizer. You can go to Bahrain. You can go to Bahrain, take a vaccine and come back, because lots of, at least I know a couple of people who have booked a 100 people together have booked a charter plane to go to Bahrain, take a vaccine, come back, then go back again, take a vaccine and come back. So I'm presuming that that is available and Covishield is available. Now the decision, I leave it on you to decide.
Thank you, sir. Thank you so much.
Thank you, Kasna Madam, for the question. Does anybody else want to make a comment? We have so many other people here. Dr. Mishra.
Yeah, can I come in, please?
Anita ji is a senior microbiologist. Yes,
Yeah,
madam.
I just wanted to know that between the 2 doses of these vaccines, can you give any other vaccine, and what effect will it have on that other established vaccine? Like if I want to give vaccine for flu or for pneumococci, between first and second dose, if I give that vaccine,
No data is available, but it shouldn't happen. It shouldn't make a difference.
Madam, I'll take that question. There is no issue at all. Routinely, when we are discharging COVID patients, we have been giving pneumococcal vaccines and flu vaccines, even now, in the last 3 months. So, absolutely, we have not seen anything. That means these are people who are getting home after being hospitalized for COVID. We have routinely given them flu shots and pneumococcal shots, usually after 14 days of the illness. Normally, we don't give below, because during active viremic phase, you're absolutely right that there is a little reluctance that when there's active viral replication, we should not give it. But we know that in COVID, the active replication or the replicative nature is only in the first 10 days. So globally also, the policy being followed is that. So technically, there should not be any interference.
मेरे को तो 2 मिनट और लगेंगे मैं किसी दूसरे प्रोग्राम में उसके बाद में बोलो मुझे कनेक्ट कर.
Yeah, thank you.
Thank you so much.
Thank you, Dr. Shashank. This is Bijon Mishra here. I definitely would like to congratulate Dr. Agarwal for doing this roundtable. I fully endorse what you said and Dr. Balbir said, that the biggest lesson as a patient advocacy person, what we have learned is there is a great need not only to upgrade the infrastructure and have more investments, which we have been talking about in public health in the country, but there is also a great need to harmonize in terms of all the healthcare which is being provided to the citizens in the country by various ministries like labor, like defense. You know, there are several ministries which are investing a lot on healthcare, which needs to get harmonized and which needs to work together in the interest of the citizens. So there is a great need to do that. I also want to take this opportunity to congratulate Dr. Jailal for taking charge as the president of the Indian Medical Association. I want to assure him that the patients groups are always there with the Indian Medical Association as usual to support all initiatives which are in the interest of the patients. Thank you very much.
Anyone else would like to make any comments? Yeah, Dr. Rai. Dr. Rai.
Good morning and very happy new year to everybody. There is no word to say kudos to Dr. K.K. Agarwal. He is really a person who has made virology, who has made this medicine and even the bacteriology so easy and so interesting in today's time. K.K. Agarwal's name has become a household name now. Even in my RAW meetings, whenever I go there, and they just ask me, Dr. Sahab, हमने आज K.K. Agarwal का वो lecture सुना, उन्होंने ये बोला. मैंने कहा जो वो कह रहे हैं आप उसको follow कीजिए, उसमें कोई दिक्कत की बात नहीं है. और बहुत अच्छी information आपको दी जा रही है. Really, we are very happy and we are very lucky to have K.K. with us. But here I would like to request the way today you have given what we have learned from this COVID is exemplary and very nice. I will request you rather to share all this your PPT so that we can also keep, and whenever it is needed, we can guide and we can make other persons to understand. And another thing, I will definitely request Dr. K.K. Agarwal and our roundtable participants, we should select some topics of interest of the public where we can teach even in the future also. At present, the pandemic has given a lot of lessons to us. But as far as medicine is concerned, as Narendra Modi ji used to say, Man ki baat, I think we should start from roundtable a tan ki baat. That will give a lot of serve a lot of purpose. Anyway, kudos to Dr. K.K. Agarwal and thank you very much.
Thank you, Dr. Rai. It will be called KK's Tan Ki Baat. मन से. Okay. Anyone else?
You can invite Dr. Atul and Gyani ji.
हाँ जी.
Say anything.
Dr. Atul and
Thank you so much, sir. This has been a wonderful learning experience. Very, very exemplary, as Dr. Rai and everybody else pointed out. It's been a learning in itself. Your summation in a very, very structured manner. It will also go a long way, as Dr. Rai said, in case we could bring out further this thing, how to bring about a fall in CRP. If it can be done, what are those diets which you mentioned about? The inflammatory, the non-inflammatory, the thrombotic, and the other diets. So I'm sure you've been telling all these things, but it'll go a long way in case we can propagate that message also as part of the Taylor and the Babar this thing. No, these are very good learning experiences, sir. And we look forward to your talks. And I think there should be compulsory teaching at all levels, how to give a presentation, how to go about, and wonderful experience as usual. Thank you so much, sir. We will keep visiting you again and again. Thank you.
I just want to make one point. Hello. Can I say one point? Yeah. Thank you, sir. Besides the whatever the Dr. K.K. Agarwal sir told today and summarize all the, whatever the last year in pandemic we learned. But besides this is very important, and this is actually how to change our lifestyle, so that at least not only for your health but also for environment. We have learned during lockdown and how the environment was clean and the air quality was good, and water, you reduce the water pollution, and so many things. We learned during this pandemic and lockdown. So we have just as a part of the Heartcare Foundation of India, we also done studies on the air pollution across India, and how particularly the PM 2.5 and PM 10 levels were reduced across India during this pandemic. And this is directly, so this is all, indicate that all anthropogenic sources are contributing toward these pollutions. And if we change our lifestyle, not only we can, protect our health, but also environment. This is a very good learning and lesson for us. And Dr. Agarwal always covered in so many lectures. We have also roundtable environment, which is on Sunday. So we cover all this topic, and this is for all a learning for us. For both for the health and environment. Thank you so much.
Gyani ji.
हाँ नमस्कार यार, थैंक यू जोशी जी. मैं ये कहूँगा कि एक जो सबसे बड़ा एडवांटेज हुआ है कि society has become more resilient now. I think this will have long-term impact on the behavioral changes it will bring in the society. So that is a plus point of this COVID time. दूसरा है कि government also has learned one point that public health needs to be strengthened. और दूसरा ये है कि गवर्नमेंट को ये भी पता चला कि प्राइवेट सेक्टर आल्सो इज इम्पोर्टेंट. आई थिंक सो फार दे हैव नेवर बीन टॉकिंग so good about the private sector, but they realize that private sector has contributed a great deal in this point. चीज ये है कि जो clinicians हैं वो थोड़ा सा और academic हो गए हैं अभी. I think this point that it will bring clinicians back into the academic fold. They will take a little bit of more interest in the research and the development work. So these are the all plus points. Regarding KK, I have only put a comment in the box. You have seen that he has become a household name in, if not the country, at least in Delhi. Now the challenge will be that in 2020 he has done so much. He has to raise the bar.
Yeah.
The expectation for 2021. अगर इलेक्शन होते 21 में तो मैं कहता हूँ MP का इलेक्शन वो hands down जीत जाते थे, लेकिन अभी इलेक्शन नहीं है, so he has to do something much more than what he has done in 20. Thank you very much.
Hanji.
I think if there are no more comments, I think we should close this meeting. It's well past 12:05. Yeah. I thank all of you all on behalf of Dr. K.K. Agarwal. And once again, a happy and a healthy 2021. Let's hope that we will be coming out of this year completely COVID-free. And as many people have suggested, we can have Tan Ki Baat from KK with a lot of month.